So we're going to be talking about cancer, survivorship, and prevention, and the emphasis tonight is going to be on survivorship. The opinion, we think the facts support the idea that for the cancer patient, their lifestyle choices are as important as anything else they choose, with the possible exception of the surgeon. So we would argue that changing your lifestyle has as great as impact on outcomes from cancer as radiation, chemotherapy. And as I say that during the talk, should not be taken as suggesting that you shouldn't get radiation and chemotherapy and eat broccoli instead, but that they all are important. And furthermore, I'm hoping to show in the data that you're going to have fewer side effects from conventional therapy like radiation, chemotherapy, and you're going to heal faster from surgery, and you're going to bounce back faster if the cancer patient really employs lifestyle medicine aggressively. What are you spending your time on? Are you spending time on, and what do you want life to look like? Because if you're in my office, there's probably something not right. In other words, there's probably something wrong with you. And so, do you want to fix it or don't you? And if you're in my office, you might be somebody who's interested in doing it with minimal drugs. And that takes a bunch of work. If you want an easy answer, don't come to me. So what I'm saying is that you're absolutely right, it does take a lot of time. In this case, they looked at the risk of the amount of exercise people were getting and their rate of cancers, and anywhere, let's call it a third to a half less cancers in people who exercised around about 150 minutes a week of moderate or 75 minutes of vigorous activity. And not just lower risk of cancer incidence, but a substantially lower risk of dying of cancer. And you can almost abolish type 2 diabetes with exercise alone. Remember, think of the exercise as attacking your cancer, attacking your heart disease, attacking your depression, and realize that it's a very real metabolic effect. And one of the reasons we mention 3 times a day is that in terms of blood sugar metabolism, which is closely tied to cancer outcomes, 3 times a day works better than once a day. So the way they've done these studies, they have people exercise for like 45 minutes a day once, or 15 minutes 3 times a day. And the 15 minutes 3 times a day group do better than the 45 minutes once a day. And if you look at historical precedent, humans up until the 50s or 60s didn't need exercise programs, right? Life involves activity. And so one of the interesting things is, historically, if you use historical precedent, which we think is what should be one of our priorities, historically, people who were active all day. If you're a woman kneading bread, hauling water, feeding the fire, chopping wood, throwing something at the dog, I don't know, I'm starting to make stuff up, but you get the idea. Life involved a lot of activity.